Okay. It started recording. Good. So first things first, the exam is going to be in the classroom. And I'm sorry, I'm going to take this off for a second so that they can hear what I'm talking about as well. I'm putting it, as I say, as a recording. So hopefully this can be heard. Maybe there. Let's turn that up as much as possible. That way I can post it for the nighttime people and for anybody else, right? That makes sense. Make it fair. So you'll be here, you will be on your laptops, it'll be en masse as a group. I'll give you a code. You will have 100 minutes. It's going to be 50 questions, okay? So just so you know what to expect. So let's just go through and I will give you some idea. And Asia, I didn't realize, so you're not doing Pharm though, are you?
No, ma'am.
See, she did great in Pharm.
You did.
She did. Yeah, absolutely. So remember how yesterday we sort of managed to get through pretty much 5 chapters, but I said to you there was going to be a fair bit on Parkinson's. I mean it, there is going to be Parkinson's. So I really need you to know about the teaching for a patient with Parkinson's disease. Remember some of the things I talked about, right? It's not curable. So the medication, they need to take this med so that the dopamine receptors don't completely diminish, and also for their symptom management, things of that nature. That the medication might take a little longer than they might think the medication's going to start straight away. That's not the case, right? There's a lot of other things as well. Making sure they don't really take over-the-counter medications unless they're approved by the doctor. Okay? Gabapentin. Remember I said to you some people are on gabapentin, but not necessarily for seizures. Remember I mentioned that? Most of what I talk about, and Asia will attest to this, is because when I'm saying this stuff, it's like, probably need to write that down. Probably need to circle it, yeah? Yeah. When I'm saying this stuff, there's a reason for it. All right. Remember I mentioned a medication called entancapone? Entancapone?
Can you spell it?
Entancapone. And there's something related to that medication. It's a Parkinson med that I mentioned yesterday. So I would suggest you look that one up. What about anorexians? Need to know about those types of meds. Remember anorexians? What type of med is it? Who had the stimulant group? It's a stimulant, so think about it. Benzodiazepines. You need to know about benzodiazepines, please. Patient teaching. You think it's a good idea to drink alcohol? Think it might cause drowsiness? Yeah? Okay. You need to know about key terms like first pass effect. Remember what I said about when some medications that you use, for instance, that are going to cause paralysis for, say, intubation. So what do you think is necessary to have close by? If we're paralyzing a patient, what?
Sedation.
What'd you say?
Sedation medicine.
Yes, but we're paralyzing them, so respiratory. Think respiratory. We're paralyzing them for a reason. All right. The patient is having opioids. What would be the slowest form of relief? Meaning, remember that list where it said oral dosing and different types of dosing, what works quickest and what works slowest? So you need to think about that. I'm recording this. Okay. Remember I talked about general anesthesia yesterday and some of the adverse effects. So you need to know you need to know the adverse effects, but there was one that I hammered home to you because I said it's going to be on the test. So you need to know what that is. Remember about some of the medicines for anesthesia that are moderate anesthesia. And remember that the patient might still, although they're sort of under, they may still hear everything that's going on, right? Understand what half-life is. Understand drug toxicity and the elderly. What types of factors would be involved with the elderly regarding, let me think about this without giving it away. We're giving medications to the elderly. Do you think they metabolize things as quickly as somebody, say, your age? No. So think about why that would be. What's going on with their body? Okay. Remember I talked about certain things to do with principles that we have to work by, meaning ethics, right? So understand those ethical principles and remember some of those terms. Anyone remember any of those terms that I talked about? No? Yes? That's okay. Now you know what to study, right?
You said ethical terms?
Yeah. Ethical terms. Know as well about, when we talked about ethics, some of the other principles that are involved with ethics and some of the terms. Say, know your 9 rights for medication. Hey. I'm going to have a couple of minutes.
Yeah, this is, I'm just giving this to you. This is what I'm giving them for their vital signs and stuff.
Oh, okay.
Just, Jessica,
She'll be back in a second.
Okay.
Yeah.
if she wants a set or you want another set, I'll give it to you.
Oh, okay. All right. I'm just going some lab stuff with them. Thank you. All right. Let's see. All right. Know about the side effects of Tylenol or acetaminophen. What types of characteristics does an opioid drug overdose look like? Know how many rests, are a normal rate, because there's a question on that. Remember what opioids can do, what sort of side effects opioids can do to the respirations, right? So be aware of those things. Let's see. Remember we talked about anxiety meds? So I would know your anxiety meds and know your insomnia meds. Remember we talked about extended release medication? And thinking about things like methylphenidate. You think that would be a good medication to do at night? No, what is it? What is methylphenidate though? It's Ritalin. Yeah, it will keep you awake. I'm sure. And I think we did it, one of those dosage count questions with it, right? All right, so think about interactions with certain herbs. Remember, I gave you, I sort of said hone in on these boxes where it said certain herbs. Remember, we talked about a few of them. There were like half a dozen. Okay. What's dilantin or phenytoin? Anybody? Who was my epileptic? Yeah. Again, Parkinson medications. You need to know about the side effects of them. Remember what I said about carbidopa, levodopa? And today you're talking about vital signs, right? So you need to know your vital sign ranges. What is a slow pulse? What is a fast pulse? What's a good blood pressure? What's a low blood pressure? What's a high blood pressure? Need to know those things. Let's see. Migraines. Remember I talked about some migraine medications? Think about what would be what's called an abortive migraine medication rather than preventative. What was the biggie that I talked about? Anyone remember? What one? I couldn't hear you, I'm sorry.
I said feverfew, but.
Feverfew, but that's a herb that's used, yeah.
Oh, okay.
But that's good that you remember that. But triptans, remember we talked about the triptans? Yeah. Let's see. Barbiturates, remember those? What are they used for? Remember I said predominantly they're used for what now? Are they? What are they used predominantly for? We don't use them so much for sedation, we use them more for phenobarbital, think of epilepsy, seizures, things like that. Let's see. Think about your older patient and over-the-counter medicines. Okay. Let's see, what else? And then that's pretty much, you're going to have, let me see what type of dosage calc. So the reason I did an intake and output one is because guess what? You're going to have an intake and output question. You need to know the differences between micrograms and milligrams. Know your desired over half multiplied by volume. Know the 9 rights of medication administration. And let's see, you've got about five dosage count questions, I think, 5 or 6. And know how many mils are in a teaspoon?
5.
All right, 5. So you need to know those things. Okay?
How many questions am I?
There's 50 questions. You'll have 100 minutes. And you'll need your laptops. And we'll all start at the same time and finish at the same, well, you'll finish whenever you finish, but you'll have 100 minutes to do it. Okay, is that helpful?
Yeah.
Gives you some areas to sort of focus on, doesn't it?
Mm-hmm.
Okay.